the way that HIV testing is done now is essentially it's usually a rapid test to look for the presence of antibodies that you have against HIV. And there are other forms of tests that can detect HIV a little bit earlier, and those can look for other things such as the protein of the HIV virus itself or the RNA of the HIV virus. But your most simple, most low-cost test, it is a rapid test, just like a self-test. It looks a bit like, if you haven't taken an HIV test, it looks a bit like a COVID test or a rapid test as well. It's a strip. You would use typically blood for a HIV rapid test that's done by a provider. And it'll have a band for control and it will have a band for HIV positive or not. Some of these tests, they come with some kind of a device. For example, the Genius is a device where you put one of these rapid tests into a small device and then it can read results into a computer. Some of them actually, if you have to run many, many rapid tests at once, it's more of a lab test. So that would be someone with gloves and a pipette, and they would have a plate with, almost 100 little wells that they can do all in one go. But that's the most common is the rapid antibody-based test. I think of the Alere Determine, which is, it's about 70 cents now. The price just keeps going down and down. It's the most common so-called A0 test used in low middle income countries such as across Africa. And I say that term A0, there's some jargon around the test sequence that you would use, where the very first test is the one that you use to determine if the person is likely positive, and then you would use different tests, often tests that work the same way. They're still looking for HIV antibodies, but they're a different brand. They might look for slightly different antibodies just to confirm that test and make sure it wasn't a fluke, because you don't want to give someone a lifetime of treatment without really being confident that they're positive.